Okay, I'm going to be giving digoxin IV push today. So I'm going to get my MAR and check for the right patient, the right medication, the right time, the right dose, and the right route. I'm also going to check for allergies. I'm going to check the MAR a second time and make sure I have the right patient, the right medicine, the right route, the right time, the right dose, and check for allergies again. I'm going to get my IV drug book and make sure that it is a safe dose, and it is. It's ordered according to the weight of the patient, and I would titrate it up according to the patient's symptoms. The dilution is, it may be diluted in 4 mLs of normal saline, and that is what I'm going to use. And I'm going to check for compatibility, and it is compatible with my primary, which is normal saline. And my rate of administration, I'm going to administer it over a minimum of 5 minutes. I'm going to monitor my patient for anorexia, nausea, vomiting, vision changes, and cardiac arrhythmias. I'm going to monitor the heart rate and the blood pressure, the potassium level and the DH level, and if my apical pulse is below 60, I won't give the medicine. I'm going to wash my hands and gather my equipment. Alright, I've got my MAR and my digoxin. Make sure it's the right medicine. And it's in a glass ampule, so this will be unbroken. I would take an unopened alcohol swab and open it away from me and put that in the sharps container. I've got my normal saline, my 5 ml syringe, and I've also got my blunt needle and my filter needle. I'm going to use my filter needle to draw up my digoxin since it's in an ampule. And I'll be drawing up 1 ml of digoxin. And I'm gonna be careful not to touch the neck of the bottle to contaminate it. And I've got a total of 1 ml of digoxin. And I'm going to scoop my cap and recap it. And I'm going to switch to a blunt needle to draw up my normal saline. And this filter needle will go in the sharps container. I'm going to be drawing 4 mLs of normal saline for a total of 5 mLs. I'm going to get my alcohol prep and clean my normal saline vial. let that dry. I'm going to scoop the cap up. And I have a total of 5 mLs. Now I'm going to go ahead and label my medicine. Make sure I have the right patient, the right drug, and when I prepared it in the amount on there. I'm going to go ahead and get my MAR and go down to the patient's room. I'm going to wash my hands again before I enter the room. When I come into the room, I'm going to introduce myself to the patient. I'm going to ask them for their name and their date of birth. I'm also going to ask them if they have any allergies. I'm going to explain the procedure to the patient, make sure that they understand why they're getting this medicine. I'm going to go ahead and lower my bag of primary fluids below the patient's arm. And if I get blood return, I know that it's patent and that I can give the medicine. I'm going to look at my patient and make sure there's no redness or swelling around the IV site. And I've identified my patient with 2 identifiers. They don't have any allergies. And I've got my medicine, and I'm going to check it against the MAR again and make sure everything's okay with that, and make sure I have the right amount. I'm going to choose the port closest to the patient, and I've got my alcohol prep pad, and I'm going to clean the port. Okay, let that dry. I'm going to take my needle off, and that's going to go in the sharps container. I'm going to insert my syringe into the port. I'm going to look at my watch to see when to start. I'm going to clamp off my patient's port here, and I'm going to start, and I'm going to give 1 ml over a period of 1 minute. I'm going to go ahead and push 1 ml. And then I'm going to release, and I'm watching my time. I'm also checking my patient to make sure there's no redness or swelling, and monitoring my patient to make sure they're not having any adverse side effects. It's been a minute, so I'm going to go ahead and clamp, and I'm going to push 1 more ml. release. I'm going to monitor for redness and swelling. I'm going to ask my patient if they're experiencing any nausea or visual disturbances, or if they're seeing halos. Okay, it's been another minute, so I'm going to push another ml. I'm going to clamp off and push and release. I'm still monitoring my patient and making sure my IV site is still good. It's been another minute, so I'm going to push another ml. I'm going to clamp off, push 1 ml, and release. Okay, it's been another minute, so I'm going to clamp off and push my last ml. And release. I'm going to monitor my patient, make sure their IV is okay and they're not experiencing any nausea or vomiting. And then I'm going to document.